Right. So today we will be having 1 hour of lecture about this coronavirus situation in East Asian medicine. So I will be cracking on, and if the time is short, then if you guys enjoy the today conversation, then we can probably repeat it next week to go even deeper or to talk about some other subjects, because probably we're going to be sitting on our chairs next week as well, much probably. So
Yani,
let's see how it
yeah,
goes.
sorry to interrupt.
Yes.
There are some of us that, because of this crisis, they have 3 times the work they had before, like me.
You
I don't
have
know
free
what kind
time?
of karma this is. When everybody slows down, I have even more work, you know?
Right,
So
right,
I'm
right.
not, yeah, so that's just a comment.
Okay, yeah, I get it. So we have covered some stuff in the classes about causes of diseases. As far as I remember, we have not talked that much about epidemics. So I think it's a good opportunity to talk about some different things. And I'm going to start this talk today with uh, an interesting thing. I know that most of you are not very familiar with Chinese years. I think I've told you in the past that actually we have a cycle of 60 years. And these 60 years, they come into place with the combination of Tiangan, which is the heavenly stem, and the Dizhi, which is the earthly branch. So the combination of the 10 stem branches, the 10 heavenly stems and the 12 earthly branches, the combination of those two produce this cycle of 60 years. So every time there is a situation like this, my mind always go back into what the chapter of Wu Yun Liu Qi. Maybe I can find it later on, and I don't think today, but one of these days I'm gonna try and send you the chapter from the Yellow Emperor, because it has a lot of interesting information about this particular topic, which is how we are affected from the climate. And the biggest influence of our climate is the sun. And every year the sun has a different Tiangan, which is heavenly stem. And that is affecting a lot of the situation down to the earth. And of course the people, and the people, of course. So this outbreak took place in December of 19, which is a Jihainian. Jihainian is a deficient Earth year. Yeah. And if you remember, I don't know if I've talked about it or if Ben have talked about it. Actually, the years change into different time. It's not like 31 of December. They change around beginning of February, right? But when we are at the end of the year, there is not like a clear cut, because actually it has to do with the position of the sun and the other planets. So it's more like a mixture. When you are at the end of the year, it's more like a mixture of energies. And today I'm just gonna briefly talk about that, because you don't know into depth the Wu Yun Liu Qi, which is a stem and branches philosophy. So the sun is the most important, and last year it was deficient Earth. What does that mean, deficient Earth? It means basically that the Earth was weak. So we know that the organ which is related with Earth is spleen. The Jung organs are considered the most important organs, right? So last year we had deficient Earth, and that came together with this year, which is excess metal. We know metal, it has to do with lungs. Yeah. So imagine, I was very surprised. Imagine this combination of deficient Earth and excess metal. And actually, what we have seen and what we have read from people treating coronavirus patients, mostly in China because they know Chinese medicine, is that this syndrome is very much related with that. So it's like an excess syndrome of the lung because it is mainly affected by turbidities as phlegm. And at the same time, we have symptoms of spleen deficiency that are manifested also with damp production. So it is very interesting. And yeah, probably you can read more in the chapter that I'm gonna send you. So everyone can see my screen, right?
Yes.
Okay. So I'm gonna start with a short overview of what is going on in the history of East Asian medicine and the fight of epidemics. So historically, we have from Qing dynasty, from Zhou to Qing dynasty, which is 1000 before Christ till 1911, we have like 350 epidemics recorded. So we have to understand that East Asia is a huge place, and back then it was not that the climate, we consider that the climate now is very unstable, and back then it was like a heaven. Actually, it was not like that. There were times that they had floods, they had tsunamis, they had all kind of things going on. So life was not easy, and that brought a lot of epidemics. And of course, they had to fight those. And of course, they used what we call today East Asian medicine. Back then, it was just medicine, right? So there is a lot of experience. It's not something new for them. Personally, I was there also in 2003. My first year in China, it was 2002. I went back, I left after I finished with the first year of studies. And then I went back, and I was into the SARS virus, if you remember, back in 2003, which was a huge thing. Yeah. So even in today's era, there is a lot of experience. And what I've seen in SARS is that China has successfully used what we called Western medicine or conventional medicine in combination with East Asian medicine quite successfully. So usually, why did I started my my talk with having a look of the climate and of the energies of this year? Because also in East Asian medicine there is a lot of focus on how the energies are moving, and how the energies are affecting our health. I remember one of my teachers used to say that there is a difference between the Western medicine and East Asian medicine, and one of those is that if we see Western medicine, let's say for example in this room we have a lot of bugs, or let's say we have a lot of virus, right? What we do in Western medicine is that we try to find weapons such as vaccines or some kind of drugs in order to fight those bugs or viruses. In East Asian medicine, what we're trying to do is we're trying to regulate the climate, because we know that initially the problem was with the climate. Yeah. So and we can see that all over the place, and also it's what the science are saying now. For example, I was reading one article and it said that if we increase humidity by 1 degree and temperature by 1 degree, the virus become less aggressive and it spreads less. Yeah. And so Chinese medicine understood, of course, what the scientists also understand today is that we do have this kind of crisis now because of the climate. There is no other reason. And this is why they are keeping the people inside, and they are waiting for, the climate change, because as long as it becomes warmer and probably the humidity will be increased, then the virus will become less prominent, and then they fear that when we are back into winter time there will be a second wave. Yeah. Why is that? Because the climate will be facilitating that. And we know, of course, with other kind of diseases which had like epidemic kind of distribution, for example, malaria, right? If you have the correct climate, a lot of humidity, a lot of mosquitoes, then you have a lot of that, etc. So climate is very important. I remember I was explaining you about this sentence in the class we had, and I've asked you to memorize it. Maria, did you want to, did you have some, or you want to wait till the end? You want to wait till the end, or you want to ask something now?
I wanted to ask something, but you answered me,
Okay.
without asking.
Okay.
Okay, fine. Thank you.
If you have some question and you want to interrupt, go ahead. Otherwise, just wait till the end and we can have like a 5-10 minutes discussion, okay?
I got confused about whether the dampness is that the worst is when the dampness rises and then everything is fine. Yes.
Sorry, your voice was breaking. Maybe you ask later. Maybe the connection is better a little bit later. Anyway, keep your question for a little bit later. So this is a famous sentence that has to do with that comes from the Yellow Emperor's Inner Classic, which says "Genchi chunei xie bukegan." So Genchi, you remember, is the right qi, or the physiological qi. Yeah. Huh?
Right.
So if this physiological qi stays inside, if it stores inside, if it's strong, this is what it means. Then the xie is the pathogens. The pathogens cannot enter, they cannot act. So this is the sentence that we should be focusing on, because we are talking about external pathogens. Now we are debating about what kind of pathogen it is, and if we have the time, I will tell you today. If not, maybe the next time. But there is still under debate what is the etiology, what is the reason why we have this. There is other people talking about Venyi, which is like worm epidemics. There are other people talking about damp and heat. We will talk about that. What is important is, no matter what it is, what is important is to remember this sentence from the inner canon, because even our leaders now, they are talking about, probably we're going to have like 70% of the population acquiring this virus, but are we going to get sick, all of us? No. Back in the days of ancient medicine, of course, if you would contract a virus or a bacteria and you didn't show any kind of symptoms, then you would not be considered as, being in a pathologic situation. But now what they're talking about, like 70% is going to receive this kind of virus. They don't mean that we're all going to get sick of it. They just mean that we're going to contract it. And why we're not going to get sick? Because our Gen Qi, our physiological Qi, is going to be strong. If it is not strong, then probably we're going to get sick. And the weaker this Qi is, the sicker we're going to become. This is why you have seen in the news, I'm sure most of you follow the news. I mean, I'm not fanatically following them, but since I'm staying inside, I like to see the news. Probably you have seen that most of the people that they are in trouble, they are because of they are in the third period of their life, plus they have some underlying pathology. Yeah, have you heard about it? Yeah.
Yes.
So these are the people that they go to the hospitals. These are the people that they, especially in Greece, that they tested positive. And these are the people that they get seriously ill, and they have also this probability that they're going to die.
Can I tell you something? Can I add something?
Yeah, sure.
Yeah, that today a friend of mine who is a Norwegian, she told me that a big research in Norway find out that the thing that Italy first, and then Spain, and third Greece get quite heavy. The virus is that they have developed due to a lot of antibiotics. They have developed, adohi. They don't react positively when they take antibiotics. So one more cause is the increase intake of antibiotics in the last, I don't know, decades.
Okay. Do you guys can hear Maria clearly? Because for me the voice is breaking a little bit.
Not very well.
Not very well.
No, I cannot hear her well either.
Okay, Maria, so then just if you want, you can type your questions at the
Yes,
end, right?
yes.
Because it's not very clear.
I'm very sorry.
It's okay, it's okay. It's okay.
Okay.
Right, so that's, I think this is where we need to focus. And this is very important for us, you know, to do prevention, and also to let the other people know that keeping healthy is the most important thing. Yeah. Now, Zhang Zhongjing, if you remember, Zhang Zhongjing is the guy that have written the Shanghai Jumping Loon, which is the treatise for cold pathogen diseases. He's the one that he has first talked about epidemic Qi, yeah. And Ke Hong was another famous doctor that he has spoken about the importance of moxibustion. I remember when I was in Tianjin in the times of the SARS, all the hospitals, and we're talking about huge hospitals, they were burning a lot of moxa, and they were also treating with moxa because of people like Ke Hong suggestion. And they have conducted researches about the function of the moxa and influence, and they have found that with scientific evidences that moxibustion can prevent. Because we know that coronavirus is mainly transmitted airborne and also through the surfaces. This smoke and what it has inside, it makes the virus less active. Yeah. Cao Yuanfang, this is another writer of the treatise on the origins and manifestation of various diseases. He he's telling us that the herbs can prevent diseases. So today, for example, in Beijing, there are suggestions from the government and from the municipality of Beijing to the people. There are suggestions that they should be taking herbs for prevention. Yeah, of course, we have also herbs for treatment, but it is important to know that we can have herbs for prevention, and of course, we can also have some food for prevention. A food that I remember we were eating back in the days of the SARS, it was garlic. So everybody was holding and burning moxa into his room or into the hospital, and they were having pieces of garlic inside their mouth. Yeah. So so you would keep 1 meter distance for sure. Yeah. In Tang Dynasty, later on, we have the first places that they are used for public isolation. And this is very important because some of the people today, they think that, you know, this isolation is something new, is something from Western medicine, and if they are more into alternative stuff, you know, they are thinking that, okay, this is not something that was happening in the past, and it's not holistic. Actually not. We have it from Tang Dynasty, and of course we have it later on as well. And of course we have the prescriptions for preventing epidemics. In Song Dynasty, because if you know the history of China, you know that there were government and there were different parts of the government, and of course there was this part which has to do with medicine, and at those times they would stop to do individualized medicine. Yeah, we might think of, okay, Chinese medicine or East Asian medicine, whatever, is always individualized, and this is why we're better, and this and that. Actually, not. In situation like this, you understand there is thousands or hundreds of thousands, even millions of people in need of medications, because they have the same kind of problems, of health issues. So since they contract the same kind of pathogen, much probably we expect that they will have the same kind of results. Of course, the underlying health condition will also play its role, but individualized medicine, sometimes at those times, if you're a government, it's not that easy to do. So at Song Dynasty they have started to create like huge portion of decoctions that everybody would drink in order to prevent and to treat as well. And another interesting thing is in Ming Dynasty, they have talked about disinfection, not in the exact words of disinfection, but they would use vinegar to clean things. We know vinegar has an antibacterial, antivirus function. They would use steaming in order to disinfect. They would cook the food, yeah. And what is very interesting also is that it is the first time in Earth that we have vaccination. We have vaccination in a very natural way, and this is another thing that people into alternatives and in this kind of mindset, they would think like, okay, I don't like vaccination, etc., because this is something new and it's very bad for health. Actually not. We see it started from Ming Dynasty, and it has eradicated the variola virus, which is responsible for the smallpox, which is we don't have it anymore. It's a very serious condition, and we don't have it because of vaccination. So East Asian medicine used vaccination. And if you want my comment here, it's just the problem with today vaccination is that it is happening in a very early age, and probably by means that also could create some kind of pathology. Yeah. So this is also important from Ming Dynasty. In Qing Dynasty, we had the theory of febrile diseases. And that's it, a little bit about the history. I think it is important to know what is going on. And we have to answer a question to ourselves and also to our family members, to our patients. People, they will ask, why are you important for this kind of situation now? I would say that first of all, it is very important to understand the situation and to give priorities. The priorities are not only set as individuals, they're also set out, in the society, because medical doctors and healthcare practitioners, that they know what's going on. Of course, they know that this is a virus that will be out there and probably is not that dangerous, but it brings dangers, maybe not to all of us, but to a percentage, and also that as a society, it will bring a lot of problems. So knowing that, from the other hand, is important to inform people about this holistic thing, because most of us, as you have said in the beginning, are worried how it's going to be the next day, and what it will be. So most of you are overthinking, worried, and all that brings, of course, as we have seen in the classes, we know that we don't have the barriers of the external pathogens when they come in. The emotions, they will affect immediately our internal organs. Yeah? So they will affect your chi immediately, or all of that thinking. So it is good to remind people that, because all of them, for the first time, they are sitting inside, and probably a big portion of them, they have nothing to do. So it is important to let them know that it is very crucial to regulate the emotions. So basically the mind, yeah? And it is also very important to, this first sentence, to keep a strong chi inside our body. And that is by also activating our chi, because most of us are now sitting down in our home, doing stuff in the computer, this and that. So what is going on with our bodies is going on with our chi. If we're sitting down, our chi is also sitting down. If we are inactive, our chi is also inactive. If we want our chi, our Wei chi, our defensive chi to go out, we also need to move it. Yeah, we need to bring it out in the surface. Otherwise, the yang chi, which is the Wei chi, will also stay a little bit not that mobile, not going into the outside. Yeah, and you could feel that with cold hands, feeling lazy, this and that. Yeah. And it is also important to let them know about, so we have the sen, the emotions, we have the chi, staying active, and also is very important what we do with our body, with our food, yeah? Maintaining a regular diet, having food that can prevent us from getting this kind of virus, or even if we get it, ways of treating it with food and some point pressing. I'm going to talk about that probably next time. I don't think I will be having time about that. Another important reason why we should be fighting this thing with Asian medicine is not only for the ones that we are staying at home and we are fighting it for ourselves and for the society, but for people that they can protect themselves with wearing this full body protection. For the ones that they can have that, they can treat people. And right now we have a problem which has no solution. In Western medicine, they are trying some medications from the past that they have been used in other kind of virus diseases, but actually there is no specific medication for this new coronavirus. And so actually Chinese medicine and East Asian medicine has a different way of seeing things. So according to our theories, we can help in the treatment. Of course, we're living in 2020, we're not living like 200 years before. So we are obliged to use the tools that we have today and try to understand what is going on and to treat it. And this is the very this is very good that we have this kind of tool, because no matter if we don't know the exact pathogen, conventionally medically speaking, we can still treat according to the symptoms. Yeah, so we can do a big difference, and it's not something that I'm saying. It is something that actually happened in China, and now there are Chinese doctors that they have gone to Serbia. I'm talking also with one of the teachers of our college, which is Philip Manja. Currently we're writing an article about it, and there are doctors that they are there giving their expertise into the medical doctors of Serbia of how they can, and their advices of how they can treat this pandemic with conventional medicine combined with protocols of East Asian medicine. The same is happening in Italy. From the comments that I have from Philip, no matter if they are trying to teach and this kind of protocols, including herbs mainly, because they are not aware of Chinese medicine much, it is a big probability that they will not be able to use it. But they have used it in China, and we know that they have used it successfully, because right now in China there is zero, as far as I know, there is zero new cases. The only cases that there are foreigners traveling to China. And this is because of they have used very successfully what they have, the tools that they have, technology. They have used the quarantine very. I have my ex flatmate there, and he was describing how from the first days they would immediately shut down whole provinces. They will just shut down, and they will just be very active into taking everyone that they have this virus into quarantine. And at the same time, they would treat them not only with means of conventional medicine, but with herbs, acupuncture, qigong exercises, diet therapy, etc. So these are the reasons why we should stay active, and first of all understand how we can help, and then let the other people know about it. Yeah, and this is the reason why we thought from the college we all agreed on having this talk today, which is going to continue next week, because there are a lot of things to be said. And here I'm just going to present you one more thing about the case of the Qingfei Paidu decoction. Qingfei means like clearing the lung, and Paidu is taking out the toxins. So this was a decoction that was given into 1,261 patients, and of course it was combined with Western medication, and that has reduced the mortality rate. So we have cases of herbs given and reducing the mortality rates. And here is what I was telling you before. This is a picture of an announcement of the Beijing administration of traditional Chinese medicine, and it gives herbs, herb formulas. It can be either for prevention or for treatment. Yeah. And I'm going to talk about some facts of the coronavirus, explain a few things, and then we're going to leave it there. First of all, because yes, you will be treating people with East Asian medicine, but we're living in 2020, so you need to understand a few things of conventional medicine. So everybody is talking about virus. So what is a virus? Yeah, we're talking about coronavirus. So viruses are very interesting things. I'm saying things because we don't know exactly how they came into being. Yeah. Basically, if we see it from Chinese medicine point of view, it's something more like an information than anything else. If we, from the one hand, from the other hand, if we see it through their from their pathologies, then we would consider them as external pathogens. Yeah. Why I'm saying that they are like information? Because actually they are not living things. It's just stuff of information. So basically it's like a capsule that inside has DNA and RNA. And DNA and RNA, for the ones that they don't remember, basically is DNA is information stored into chemical compounds, and RNA is the stuff which comes out of DNA. So this information, it is wrapped in a cell, like it has an envelope. It's like an envelope, basically. Yeah, you have an envelope, and inside you have a letter. This is the virus, and you get this envelope. It opens up, and then your cells are starting to reading it. And by reading it, they produce more envelopes. And at this process, they also get kind of disoriented, because it's not only that they have their own information there, they also have some other information. Yeah. So these are the viruses. So this is one important thing about the virus. When it comes to Western medicine, I want to say a little bit that what they're trying to do now is they're trying to get a new vaccine. And also they have tried to treat some people in a similar way. So what a vaccine is, basically you get this, let's take the example of the envelope and the letter. Let's say that you chemically are ripping out the envelope and you're just taking the letter, and then you are making it into small pieces, and then those small pieces you are throwing it inside the body. So you are throwing some information, but they are kind of they're not dangerous because they don't contain the information in a way that it will be readable from the cells that we have, and we cannot have new virus coming out of that information. But our body can use that information in order to receive it and create antibodies in order to fight the virus if we contract it another time. Yeah. So this is what they're trying to do, let's say, in countries such as Britain and Sweden. Is it Sweden? Yes, I think it's Sweden. That they do have some measures, but they are not so tight, because they know that as long as the people contract this kind of virus, the immune system will get activated. Actually, it will cut down by itself, because this is what our mast cells, which is part of our immune system, this is what our cells are doing. They are receiving what is not ours, and they are making it into pieces, and they are presenting it into some other cells, the lymphatic cells, and then there are produced antibodies, and the antibodies are there, and we will also be remembering this kind of virus. Yeah, so this is the natural way of fighting it. But also, if we create the same thing as a vaccine, and this is what they're trying to do now in Western medicine, then we do the same, not naturally, but with a vaccine, with an injection of this virus that is not active. Yeah. So these are some facts, and I wanna. Probably most of you are listening to the news, and most of you know that, as I said before, this is mainly affecting and is causing health problems to the third age, or to people that they have, to third age. So here I have what we call a normal distribution. So this is a little bit of statistics. I think sooner or later you have to learn a little bit, because you will have to be able to read scientific articles about East Asian medicine, and why not creating a research. So this is one of the most easy things we have in the statistics, which is called normal distribution. So basically, statistically speaking, what we're doing is that we are taking all of the patients, and we are spreading, for example, if we take their age, we are kind of distributing or spreading into an even way the age. So for example, let's say we start from the youngest age, which was, I don't know, 9 months old, till, I don't know, 98 or whatever. Yeah. So we put all the ages there, and we have a mean age. So the mean age, if you see this diagram, the mean age is on the 0. So let's say, for example, the mean age is 65, yeah, or 70, something like this. Now, we know that minus and plus 2 standard deviations. Standard deviation, I don't want to explain you now what it is. You can see it later on. I don't want to go so deep into it. But minus and plus, standard deviation in terms of age it could be like 10 years, let's say, for example, right? So plus minus of 2 standard deviation, which is 20 years, that gives us the 95% of the diseased people. So for some of you, maybe it's difficult to grasp it. You can go into internet and read a little bit more about it. I want you to explain a little bit of the things that you are hearing into the news. Because why am I explaining this? Because, you know, we have people from the news saying like, but we thought that only old age people contract this and old age people die. Why do we have like a 40-year age of person had that? Or why did we have that age of person died? Because if you see, as I said, if you see this diagram, if you see the 0 and if you see the -1 and -2, and on the right hand side if you see 1 and 2, these are the plus minus of 2 standard deviation, which is the 95%. So if we say the 0 is 65 years of age and the standard deviation is, let's say, 5 years, 2 standard deviation is 10 years, so it's 65 minus 10 years is 55, plus 10 years is 75. So that means that 95% of the people will be having, will be between 55 and 75. That is 95%. But of course, we will be having a 5%, which is 2.5 on the left-hand side, which is from -2 to -3, and 2.5 from 2 to 3. We have this 5%, which will be different kind of ages. So of course, we will be having older or younger people contracting that, because this is the way statistics are. Those people do not understand it because they've never studied, but I want you to understand a little bit why this is happening. If it is difficult for you to grasp it, you need to go and study a little bit of this normal deviation thing, okay? And the last thing I'm going to talk today, I have so much more things to share. I don't know if 1 hour next week is enough, but anyway, we start with 1 hour next week and then we take it from there. I want to talk a little bit about the death rate. For example, do you have your mobile phones somewhere? Because I want you to calculate a little bit what is going on with the death rate. Yeah. So anyone knows how many people we have in Greece contracted the disease, approximately?
You mean those officially verified?
Yeah.
Can you hear me? It's 900.
So it's 900, and the deaths?
25, let me check.
You said 900, so it's 25 divided with 900, you get 0.02. You multiply that.
Sorry,
with,
now, yeah, the newest I see is 966 confirmed cases, 966, and 28 deaths.
So 28 divided, okay, 28 divided with 966, you get 0.02. You multiply that with 100, and you get a mortality rate of 2.8. That means that for every 100 patients that get inside the hospital, because at the moment most of the people that they are positive, not all of course, but they are hospitalized, there is in every 100 people you have 2.8 people dying. But actually, it's not like that, because they say it's around 4 times more cases out there. So if you multiply 966 4 times, that's 3,860, right? So if you have 28, 3,608, you get 0.007 multiplied with 100, that's 0.7. So the actual death rate, because the death rate now, it is out of the positives that we have. But I know so many cases that they never went to any doctor, or they never said that they are sick, right? So actually, when you hear of death rates, this is not the accurate thing. It's much less. And if you know that, you can feel less fear, yeah? From the other hand, that should not be a reason to make you feel very secured, because as you've seen in the previous, in this kind of, the 95% of the people will be third year of age with underlying health issues, but there is a 2.5% that they are younger and healthier. So we have the example of this guy that he came from Germany. He was very healthy, and then boom, in one day he died. Okay, I mean, this is, this can happen with anything. It can happen with a car passing by.
Exactly.
The problem here is with this kind of death rate, with the people that they go in, the problem is with that it is very easy to contract this virus. So actually, we're doing this kind of thing, as probably as you know, in order to create some space for the people that they are really sick, because actually our governments, they were never focused onto our health. They never cared about it. They just had the healthcare system just for, a little bit of support and just to say that they have it. But, in terms of crisis, they're always here. We have nothing to do, and the only thing they have to do, they can do at this moment, is to lock us down to our. And so we have incompetent governments. This is the truth, and we have politicians that they don't focus into the right things. But this is how it is. We cannot say if it's good or bad. It is how it is. We cannot be angry about it. We are one, anyway. So we have to stay inside because of that, in order to prevent from fellow people from the society not having access into the hospitals.